Welcome to the Parrot Podcast with your host, Sandra, where we talk about all things parrots.
Welcome back to another episode of the Parrot Podcast. I'm thrilled that you're joining us for today's conversation because it is packed with a lot of important topics that we need to be aware of as parrot owners and parrot lovers. So today we're going to be joined by an exotic vet who also has a background in conservation medicine and has done some conservation work. So she has perspectives from both worlds, and we're going to take a deep dive into a lot of different topics, including things that she most commonly sees in clinic that could be avoided for our pet parrots, and things that we should be doing at home for our birds, and her perspectives as a vet. And we're also going to jump into her conservation work because her resume just seems like an adventure movie. And we're going to talk more about the illegal pet trade and poaching and what she has seen, heard, what she knows about it, and what we can be doing to do better for birds globally. She holds a doctorate in veterinary medicine from the university that she went to in Belgium. She also holds a master's in conservation medicine from the university she went to in Scotland. And what really sets her apart, and in her own words, she always says most of the cases she sees in clinic could have been avoided with the right environment, nutrition, and understanding of the species. Her goal is simple: fewer emergencies and a better life for exotic pets and animals everywhere. So let's go and chat with Dr. Noémie. Dr. Noémie, I'm so excited to have you on the Parrot Podcast. Welcome. Let us know, how are you doing today?
I'm doing very well. How are you?
I'm great. I'm so excited to have you on the show and to talk about all of the great topics we're going to discuss today. Before we jump in, I wanted you to quickly let our listeners know, if they listen through to the end of this episode and really take to heart all of the things that you're going to share with us today, what are they going to gain?
They're going to gain a lot of different things. What I kind of focus on the social media part is basically I want people to take proper care of the exotic pets. So the proper care of the exotic pets goes through proper husbandry, goes through proper nutrition for the pets, and all of this is very interlinked with actually conservation issues. So that's kind of my whole role and my whole purpose on social media. And I think we're going to dive into different things here. So yeah, I also want to make sure that people kind of understand what the first signs might be of certain diseases, how they could spread, how proper nutrition and husbandry might actually prevent those diseases from happening. So yeah, there's a lot of subjects we can cover.
Yeah, I'm so excited. So start off by telling us a little bit about yourself, where you're from, your education, your background, and anything else you want to share.
Okay, that's a very vast topic.
I know. I
I
looked at
was,
your bio and I was like, oh my gosh, this is an adventure movie with
yeah.
like just so much animal action.
I shared a post not too long ago where I was like, "Oh, this is what I've done in my career," and people were like, "When you need to write a book or you need to make a movie about
Yeah,
what's
I
been
saw
happening,"
that there was
because
a part one and part two, and I was like, oh my
yeah,
gosh,
I'm not
can
done.
I
I
go
could
on these
make
adventures with you?
yeah, I could make a lot of parts, different parts. They might be coming in a few weeks. So yeah, so I was born in Belgium, but I didn't really grow up that much in Belgium. When I was 10, I actually moved to Mauritius Island, so I grew up kind of bit more in Mauritius Island. And then I went back to Belgium to do my studies to become a vet. So after my basic vet studies, I worked a tiny bit for a few months only in Belgium, and actually this I was missing the sun. I didn't really like the rain and the weather that you had in Belgium, and I moved to the south of France, where I worked a bit more with companion animal, domestic animals, and a bit of exotic animals at that point, but it was also cats and dogs. And then I always wanted to work with wildlife and conservation and odd species, I would say, everything that's not the norm, not the classic cats and dogs. Um, and so I ended up in different wildlife projects. I ended up working in Ivory Coast with chimpanzees, where I was also responsible of doing necropsies on all of the wildlife that we would find. So it was behavioral studies on chimpanzees, the necropsies. It was disease surveillance, and it was in the middle of COVID. So actually, I was also studying COVID in chimpanzees at that time. Um, then I came back. I've been working on and off with companion animals here and there. And then I ended up at some point in the Maldives working with sea turtles in a rehabilitation center. I also did an internship in a zoo setting, so where I got to work with any zoo animal you can find. And I've done multiple externships in different zoos, in different conservation projects in South Africa. Yeah. And so I ended up also working with aquatic species. I'm also very drawn to fish care and those kind of things, which people find a bit odd sometimes, but it exists. And yeah, and so now I'm actually mostly working with exotic species at this point, so pet companion species. But yeah, so
Okay.
always drawn to conservation medicine, and that's kind of like my passion.
Yeah, and you also, I read
Yeah,
you had also worked in Loro Parque in Tenerife, which is home to one of the largest parrot collections in the world.
yeah.
And what were you doing at Loro Parque in Tenerife?
Loro Parque. So I was an extern, so that was during my vet studies that I actually passed a few months with them. Most of the work in a zoo essentially is preventive care. So you want to, when you take care of the animals in the zoos, you want to make sure that they never get sick. So it's a lot of work around the nutrition, about the husbandry, about those kind of things, about taking fecal analysis to make sure that they don't get parasites. So you really do
Mm,
not want to get them sick. And when you're working, for example, in a private, in a clinic, then usually you tend to see the animals that are sick. The only kind of like preventive care that we do is like vaccinations and those kind of things. But we tend to see animals that are sick and that need surgery or that need hospitalization. So it's two kind of different worlds. So there's usually like
yeah.
preventive medicine, and then clinics is mostly, I would say, pathological treatings, etc. Even if we try to do the preventive care too, it's mostly the secondary, the consequences of what is not preventive care. And then actually the Loro Park has a huge collection of birds. They also have a whole part next to the park that is not linked to the zoo itself and that people cannot visit. That has a lot of different birds, a lot of different parrots, a lot of different macaw species. Some of the most endangered macaw species, they have some of these guys, and they breed them for then afterwards for rehabilitation projects and for disease monitoring and different studies. So it's a really great project that they have. But this is not visitable. That people cannot just visit it. It's they want to keep them away from the general public, not stress the birds out that then afterwards are actually linked to conservation projects.
I love that. And
Yeah.
how many different types of like parrot species have you worked with?
Oh, I have never tried to
Do you even
count.
know?
I don't think I know. No. The most common ones when I work in practice are usually like the African greys, the Amazon cockatiels, budgies, these kind of species. But yeah, like in conservation projects, it's more like it's other species such as the hyacinth macaws, for example, the ones that you don't necessarily see as commonly as pets, but that still exist and are in zoological settings. I've never worked with the endangered the Spix macaw. We would like to
Yeah, I
potentially work with those.
saw.
Yeah,
I
but
saw that
never worked with them.
they had like released a bunch of them into the wild and it was like this huge success. But I'm not, I think the follow-up that I saw to that was that they didn't all survive after they
Yeah.
released them in the wild.
So usually when you release animals in the wild, actually, even if it's called a success, you have a percentage of mortality of those species, in not just parrots, in general in conservation. So you have to prepare them firstly to release. So you want to make sure that they're disease free, that they're adapted to being able to find their foods and everything in the wild.
Hmm.
And you need to make sure that the environment you're going to release them in is actually free from poaching as much as you can,
Yeah.
full of the nutrition that they need and those kind of things. But then even if you get all of these things right as you think you can get them, there's still a percentage of mortality that is going to happen from animals that will not be able to adapt, from animals that will just catch diseases, because that's what happens in the wild too. And yeah, so usually there is quite a high percentage of mortality that happens. Yeah. So the problem with the Spix macaw, which is also like a very broad subject, is that they also come from a very small pool of genetic animals because they have been poached that much. So when they started breeding them, which comes like it comes from different conservation centers and zoos that have been working on this breeding, they actually started them from a very small pool of individuals. And diversity you have in genetics, I would say, the more prone they can be to congenital diseases or even susceptibility to diseases. So you actually end up releasing animals that might be depleted and not as fit as surviving in the
Mm.
wild that other species could. But unfortunately, these guys, they don't exist in the wild anymore. So the only hope to actually try to get them to survive is the ones that come from zoological projects and different conservation projects. Yeah.
Yeah, I can only imagine how difficult it is, the conservation work of like, breeding these birds that are now extinct, but then also like getting them to adapt and learn and be able to survive in the wild because we know that the wild is not an easy place
It's not.
and it is not forgiving
Mm.
and, they are surviving. They're constantly, looking for their food. And so when we have parrots in our homes or exotic pets, I think that there's just so many things to consider, and we're gonna jump into all of that because like we're trying to, as good parrot owners, we try to mimic the wild of like things that they're doing in the wild. But then at the same time, we have to remember that if they were in the wild, they would be surviving. It would be a lot more difficult. And we have the opportunities in our homes to give them really good care and help them to thrive. This is something Dr. Jason Crean always says is like in our homes, they should be thriving. And
Yeah.
like one of the things we might mimic from the wild is how much they forage. So creating foraging opportunities and creating, stations and things for them to do is really important because when we look at studies in the wild, they spend like 40 to 70% of their day foraging. And
Yeah.
that's a huge form of like enrichment for them. So I think the work in conservation is so super important. And this came to my mind, and I'm sure other people are thinking it too. So I'm going to ask you to tell us a little bit about like zoos and, good zoos versus maybe not good zoos, because there is a lot of like information also online of like, don't support zoos, don't go to zoos because these animals, don't have like the best life or they shouldn't be living in a cage. So, can you tell us a little bit about like zoo life and what it
Yeah.
is kind of behind the scenes?
Yeah. So when we talk about zoos, the things that I see online is that a lot of people think that all of the zoos are the same, I would say.
Yeah.
It comes kind of the same as when you talk about pelleted foods or something like this, that like you have some people being like pro or cons or like 100% for it or 100% against it. But
Yeah.
that's not how it is. You have different kind of levels of, how those things works. You have so there are bad zoos. There are 100% bad zoos. I've seen very horrendous things, but there
Hmm.
are also amazing zoos that are doing a lot of things when it comes to the behavior itself of the animals, making sure that all of their needs are met in captivity because it's still captivity. We need to make sure
Yeah.
that they thrive in captivity. The thing is that a lot of people they love to use this word captivity as if it's something profoundly bad. But and then when I compare it to that pet, so I'm like, your pet is in captivity, then sometimes some people are shocked. I was like, this is exactly it. It's like an animal in captivity is an animal that is not living in its natural environment and is not able to express necessarily all of its natural needs if you don't provide help for this and if you don't provide needs to actually express those natural environments and those natural needs. So some of those they do a great job doing those kind of things. And personally, I've done my internship in a zoo that's called Parc Animalier d'Auvergne, which is very French. It's a zoo in France. So basically, this zoo is its optic is that in 1 year, I think, or 2 years, they want to be the first zoo to only house endangered species, which is not the case in all of the zoos. There's actually some zoos that have species that are not necessarily endangered, but they just like to house them. It's not necessarily bad. I mean, they can also use as them as ambassadors for the species, etc. But the zoo I worked in is actually trying to aim at we only want profoundly endangered animals to make sure that our breeding programs can also help with these kind of species to make sure that we preserve the genetics because we know, for example, with the Spix macaw how important it is to preserve genetics in a
Hmm.
world of with the environment that's kind of collapsing right now due to us.
Yeah.
But basically yeah, and then that zoo, for example, all of the ambassador species that they have, for example, they house now an anteater. Just to give you an example, an anteater that they wanted to have that species because they want to explain about the different threats that they're facing. And because of them having that species, they're actually using the money that they get from the exposure of this animal, the ambassador animals you call them, to fund GPS placing on animals in the wild. And these kind of things actually help to determine what the territory in the wild might be, where they might reproduce, where they might need to go to have specific nutrition, etc. And that actually, those kind of studies help us a lot to know exactly what area in the wild should be protected for these kind of species. So there's a massive investment of different zoos in those kind of things. So, and then the thing is, the park itself has amazing enclosures. You can call them cages if you want to, because people love to call it, like, they give the very negative words, but basically it is an enclosed area. That really mimics their natural environment. They have like different types of wild goats where you have like different rocks and valleys, etc., where they can walk around, but it's still an enclosed environment. I think that also kind of like a common misconception that people might have is that they see the wild as this beautiful, kind of beautiful area in the world. But the wild is full of, like, poaching, of harsh survival
Predators,
problems, predators, these kind of
parasites.
things, which is normal in the wild, but basically that
Yeah.
exists. But also it's also kind of enclosed. So having done procedures in South Africa, for example, even the wild in South Africa it's very vast. You have vast spaces, but these spaces are limited by enclosures for the animals not to go to different cities and then attack the population in
Yeah.
the cities. And then the problem is that those kind of things might actually mitigate and might block the migration of species. And then you get
Mhm.
into an issue where you end up having, again, like kind of like a limitation in the genetics that you might have. So you might have to then intervene. And that's a lot of the work that the vets do in South Africa, for example, is intervening to anesthetize animals and then locate them to another area of this enclosed area. So even big national parks are enclosed like areas. So of course it's way bigger than what usually zoos have as space, but it is still, it requires a lot of management problem, like, to be able even to manage those wild populations because of the impact of the humans, of course. It's always kind of like linked to what we are doing and how we are living in those cities surrounding them and what we are doing with the deforestation, etc., etc. But yeah, so basically, a very vast subject. If we start talking about zoos,
Yeah.
there are very bad zoos where I've seen animals in crappy enclosures, very small. And it's not just a question of the space that they have, but it's a question of the enrichment that they might have, of the basically anything that could just cover their social needs and their physiological needs and their behavioral needs. And I've seen amazing zoos that do so many great things. And it really depends on how you call them too. I've seen some places that were called sanctuaries because they kind of like they save animals from different areas, but the needs, they were not met. They had very small enclosed, spaces, etc. So they call them sanctuaries. A lot of people find it super positive and they say, this is a sanctuary, this is what we want. But when you look at it from the pure nutritional, behavioral, specific needs for the animals, it's not necessarily because it's called a sanctuary that it's actually what you need. And same thing with the zoo. It's not because it's a zoo that you should see those things with cages and, the very old zoos are the ones that you have, unfortunately, still in poorer countries, etc. So it's a very vast topic.
Yeah. Actually, you mentioned something there, and this is something that you talk a lot on your social media. You said that most of the cases you see in clinic could have been avoided with the right environment, nutrition, and understanding of this species. What
Yeah.
are the most common, like, medical conditions you're seeing in parrots, or like what's the most common reason that they come to see you?
A massive one, and there's a lot of communication about it on social media, which I'm very happy about. But a massive one is the seed diets. That's like the really, really common one. We can go in detail
The
about it.
seed diets make
Yeah,
me crazy.
yeah, it happens all the
I've
time.
talked
Me too.
about it so much. I like, am I blue in the face?
Yeah, you're like, again. I was like, yes, but this is also something that I keep seeing. It is exhausting. I understand where it comes from because the problem is that not everybody reads up before they take an animal in. People might be influenced on with those very cute videos online when you see those parrots, mimicking and speaking and being just very cute. So social media is actually a big problem when it comes to the exotic pet trade. And then the thing is, they might also just go into the pet shop and they're actually thinking that they're asking that the people working in the pet shop are going to give them all of the information they need, etc. But there's many people in pet shops that are not necessarily trained in medical stuff and
Exactly.
in how you need to take care of these animals. And then there
Hmm.
might also be an influence of they might have to sell certain different foods that they have because they get a better margin on it. Those are things that exist. But yeah, it's not necessarily that they don't give good recommendations because I've seen some conspiracy theories that they actually want them to get sick and then they can sell another one behind, etc. It's like I don't think that this is the big thing here. I think that the big thing is that they're not necessarily trained in those kind of things. And yeah, and so basically seed diets, they are being sold easily in the pet shops because like seeds tend to be very cheap. Since seeds tend to be stuff that the parrots they absolutely love eating, but it has to be compared to a treat for a child. You're not going to
Hmm.
feed your child with 100% of treats. Um, and yeah, and the pet shops they don't necessarily know this. They're like, yeah, they love it, they eat it, we feed them with it, and that's it. And the problem is also that because parrots are also so good at hiding disease and everything will look the same, etc. Like you might actually get to a disease where they are not breathing well, where they have digestive issues, etc. But if they're not breathing well, then people will think, oh yeah, it's a respiratory problem, and they don't link it necessarily to the fact that it comes from the seed diets and from the fact that they have been nutritionally depleted. I don't know if yours is eating little seeds there in the back. Oh no, it's just butt bunking,
She,
bumping
she's
against the
all of a
vase.
sudden mad that the mint plant is there. I think that there's like a link that sometimes we miss. And, a lot of the times that's diet. And the thing is diet has a huge impact on health and well-being and how you're feeling and even how you're thinking. Like we can see it in humans. We talk about it in humans all the time. Keto diet this and vegan diet that, and I feel so much better. Juice cleanse, detox, parasite cleanse, and we see the difference, we feel the difference. Well, it's the same for our pets.
Yeah.
It's the same for our parrots or our dogs or whatever type of animal that you have. And I notice a huge difference like in our dog and even in our birds when they're eating, a whole food diet that's more biologically correct for them versus, what the pet store is going to tell you or what the pet food companies are going to be pushing on you.
Yeah, well, it really it's a vast subject. Thing is, the problem is that many people also kind of think that if we give like something that's natural and they give them, for example, just veggies, etc., it's going to be perfectly fine. But even these things need to be absolutely formulated and specific for your animal and for your animal's needs and for even if it's a male or female, there might be differences in what you should feed them. Yeah, and then the problem is that basically sometimes it's just like something might also be labeled as natural and then good for them, but it might not be necessarily good if it's not formulated properly. So that argument is actually used a lot in different marketing stuff, and yeah, and a lot of people get confused by those kind of things. But yeah, nutrition is the base of many things, and in parrots specifically, the seed diet is just a massive one because that's what's been sold all the time, and then people realize that they love it, and then they give it a bit more because it's a bias from us also trying to please our animals and make sure that they're happy. And then because they're happy, we give them a bit more of those kind of things. And yeah, I really always compare parrots to children and make sure that people understand as like it's not because a child loves a treat that you're going to feed them exclusively with these things. So you have to pay attention to this.
Yeah, absolutely. And they are like little kids, they're feathered little babies, and we don't need to treat them as little humans, but we need to remember to treat them as little birds. And that's why it's important to really learn about the type of pets that we keep and what their care requirements are. Um, so the most common thing that you're seeing is an all seed diet. So what do you recommend to the owners of those patients that come in because, they're suffering because they've been on an all seed diet? What is like your first course of action for them?
So usually the people actually have tried to potentially transition them to something else, but then when they tell me I have tried to transition, they haven't tried that many things actually. They have been trying to adding some pellets or some veggies of some different foods, etc. It's like different new foods inside of the diet, and they kind of try a bit, and then they realize that no, the parrot prefers the seeds, and then they stay on the seeds, and they kind of see this as like a fatality, and this is how it is, and he's going to eat seeds all the time. But seeds are very high in fat. They're depleted in different essential amino acids that they need. It's quite low in different calciums, etc. So if you feed them a whole seed diet, you must know that 100% your animal is going to be depleted in specific things that they need. So you absolutely have to try to do that transition. When I'm trying to recommend them to transition, I'm telling them you have to try different foods, and you have to try the different foods in different forms, in different textures, in different ways you present it to them. One thing that can actually help them when they're very stubborn and people have been trying, but they're not managing to transition that seed diet is actually to try to sprout the seeds. So this sprouting seeds is something that helps you. It changes the nutritional composition of the seed. It's still something that the animals recognize as this is something I have been fed with my whole life. They still see the form of the seed, etc. So they're like, okay, great, I can still eat this. But the texture kind of changes, the nutrition balance changes. So this is a great idea to get them to start eating some of the veggies. And you can sprout some of the most common things that we have inside the home. So if you start with the sunflower seeds that they have, you can sprout the sunflower seeds. Make sure that the ones that you get are not the salted ones that you would give to
Yeah.
humans. They're like really plain nature. The ones that they have already been eating that are really like the proper ones, I would say, for the parrots, if you can say this. You can also sprout things like chickpeas or different lentils or different things that you can sprout. And sprouting, so I don't know if everybody knows what it is. It's basically just having them grow a little plant as if you were going to grow the plant from the seed itself. And
Hmm.
then so that might actually get them to start eating some of the little veggies. And then you can start to chop in some different veggies. You can start to crush some of the different pellets. You can add a few of the fruits. So like heavy fruit diets is also kind of a problem in some species. But you can
Hmm.
just like little by little, you get them to try different textures. One of the common things is that again they're like little children, so they might actually be just interested in eating what you are eating. So you can just pretend to want to eat the sprouted seeds or the different veggies that they need to eat, etc., and then get them to kind of like steal them a bit from your plate. Not
Yeah.
always saying that they should get it from your plate, that's a whole other behavioral topic, but basically get them interested in what you're eating and giving them the feeling that they're sharing something with you. They might be stealing something from you. That might actually be something to get them to eat those things. And then another thing is that basically a study came out that shows that I think it was done with African Greys. That study shows that if the animals need to work for something, they tend to be more interested in what the food is at the end of it. So you might actually try with different foods that they're not used to get them to work for those kind of things. So when I'm talking about working, it can be with different tricks. If they're very trick oriented, it can be by hiding it in foraging structures, like just to get them to work, or those little puzzles that you can try for them to solve. And then at the end, it's their reward. And then they should go for the reward. Of course, if you make them work for it and then you always give them something that they don't want to have, then at some point they might not want to work for it anymore. But this is something that actually drives them to work a bit more for these things. And like I said, like
Yeah.
different textures also try, if you give something, let's say a sweet potato, if you give like a big piece of a sweet potato and then they don't want this, you could try to actually chop it in smaller pieces. You can try to boil it a bit. You can try to, grate it. You can try all of the different textures that they might be interested in. They need to be curious and want to go for it. So there's multiple ways. There's multiple ways you can try to transition them, and they can be very stubborn. So parrots might take sometimes, for the most stubborn ones, months or even years sometimes to get really transitioned to a proper diet. Because if they have been growing up with those sunflower seeds as the sole diet their whole life, they don't recognize anything else as foods. Make sure that you never remove the food of a parrot because they have a very high metabolism. So after a few days without eating, they're dead. That's just really how dramatic it is. So some
Oh
people are
my
like,
God.
yeah, but if I remove the food, then they will start eating when they're hungry at some point. But they don't have the time to start to get to that to get to that point where they actually want to try something else because their metabolism is that high. So never remove the food. This is not a technique. You really have to try to transition progressively.
Yeah, because they're going to the bathroom like every
Yes.
15 minutes, so
Yes.
things are moving really quickly. What about
Yeah.
removing food at night? Because this is like a huge debate, and some people
Yeah.
say, they should have some dry food or pellets at night because you don't know, maybe hunger will strike. And then other people say remove the food so that in the morning they're eating their fresh whole foods.
Yeah. So thing is, you also have to know, like in exotic animal medicine and even exotic care, there's a lot of things that is just like people talking about their experiences, and there's a lot of things that are not necessarily studied. So the thing is, with the foods, what I usually recommend is basically to remove like the fresh foods to make sure that those fresh foods don't spoil overnight and that they might not go for it, and then make sure that they don't get any, moldy, bacterial, infected kind of like foods. And then they might eat those fresh foods in the morning. I usually recommend to just leave a tiny bit of, the different pellets that they might eat, or the drier foods, just in case. But usually they tend to be sleeping a bit more. They also need to be sleeping during the night. Make sure that you cover, if they have the cages, make sure that you cover the cages and those kind of things so that they can get their sleep in. But yeah, I would say don't leave any fresh foods because they can spoil. But yeah, I'm not against like a few pellets or a few seeds even, to stay overnight. That's kind of my idea on it. But it's like study wise, it's not that much that actually really tells you this is exactly how it should be done. This is exactly how it should be done. There's a bit of pros and cons a bit everywhere.
I actually read that African gray study, and the term is contra freeloading. And in the study, they noticed that the African grays would prefer to work for their food than just to take the food that was readily, easily
Yeah.
available. And that it like studies like that help us understand like how intelligent parrots are, even if they're as small as a budgie or as big as the biggest macaw. They have that need. It's like wired in them, to forage, to look for their food, and it gives their brains something to do.
Yeah.
Because if you think about like in the wild, like if they're spending like 8 hours a day, foraging, moving around, and then at home, we just kind of give them a bowl with everything that they need in that bowl. They don't need to look for it. No wonder that we start seeing behaviors like screaming or maybe feather plucking, and, they're getting frustrated because those needs are not being met. So the way that
Yeah.
we feed our birds and also how we're feeding the things that we're feeding them is important to give them
Yeah.
those opportunities. Like you said, put it in a puzzle toy, stuff it in something, even cover the bowl with, some crumpled up paper so they have to move that out of the way to get to the food because it just helps their brains work better.
Yeah, absolutely. And then it really depends on it's linked to a bias that we might have because we think that if we make them work for it, that we're kind of like mistreating them. A lot of people are like, oh yeah, but poor guy, they want their seeds. Like if I make them work for it, they might eat a bit less, but they really want it, so they're frustrated. It's really it's a bias, an emotional bias that humans might have that like we want to just please them. But yeah, this just by trying to please them in a way that we see as pleasing, it is impacting them, and it is leading to multiple diseases and problems like what you started mentioning is basically obesity. They get very fat very easily because they're not working for stuff. If they're not walking around and they just have everything in one space, they don't have to walk around, they don't have to go and look for their foods. It can lead to different things like obesity, which then to stuff like arteriosclerosis, which leads to heart disease and strokes in birds. It's a very massive topic. And then yeah, boredom can lead to feather plucking disease. So feather plucking is also linked to different diseases themselves. It's not just behavioral. That's also
Hmm.
something quite important to cover. But yeah, the boredom can then lead to those kind of behaviors. And yeah, and then just boredom, basically, they don't have anything to do anymore. They can start to destroy things, and then because they're destroying things because they're just profoundly bored, and people don't want to keep them anymore, they get rid of the parrot. It's like and then we go back to basically the conservation issues too. It's like some animals being taken from the wild for these things to then actually be being abandoned afterwards. So it's a massive interlinked problem, and we have to adapt to the animals and learn what they specifically need for those species specifically to make sure that we give it to them, not necessarily what we want to give to them, but what they need.
Yeah. I in one of the videos that you posted, you said something that I thought was really awesome. And you mentioned that you're not saying that like we shouldn't have pets or people shouldn't have pets, but whatever type of pet that you do keep, you need to be able to care for it adequately and also learn about them and make sure that, you're providing them with everything that they need.
Yeah.
Because when we take them in, it is a responsibility, like when you have a baby, they're your responsibility. Maybe we didn't give birth to them. We might think that we did because we get super attached. We call ourselves mom and dad. But, you need to care for them just the way that you would care for your kids. Like you're not going to, the example you gave earlier, you're not going to give them candy or, buy them McDonald's for every meal just because they like it. You want them to
Yeah.
be healthy. You want them to be fit. You want them to thrive. So, it's really important. And that's why we talk about all these different things. But one thing that surprises a lot of new parrot owners is how well birds can hide illness. And animals in general, even like dogs, like with our dog, for example, like I can tell when something's going on, but dogs will hide pain and, other types of things. So, um, from your perspective as a vet, what are some subtle signs that something might be off or you should go get a checkup with your avian vet?
Yeah. So birds, I honestly find that birds are kind of like the tops on this planet and in being able to hide disease.
That's
Um,
crazy.
yeah, they're very good. And then the problem is that it kind of is all linked to a prey situation in the wild. Even with
Yeah.
different dogs, etc. It's not because dogs are kind of more predators in the wild, even though dogs still exist in the wild. It's basically if you show that you're vulnerable in the wild, you can get eaten by a
Yeah,
predator.
you're gone.
So
You're
yeah,
toast.
yeah. So you try to hide as much as you can. So basically anything that is odd with your bird, if you see them, for example, liking certain foods usually, and then suddenly they don't want this anymore, it could be already a sign of disease. It's not necessarily just that because they're being fuzzy. Sometimes they can be, but
Yeah.
it's not necessarily this. It can be that there might be already something behind it that is already brooding and a disease developing. If you see them, so basically, if you see them go off food completely, even for one day, you have to run to the vet because, like I said, they have a very quick metabolism. If you wait a few days with them not eating, which you could potentially do, I'm not saying that you should do it, but which you could potentially do with a dog. A dog would survive 1 or 2 days without eating. A bird, you get into a critical stage with a bird if you do this. So going off the food, breathing a bit oddly, staying fluffed up, in a side in an area that they usually not don't necessarily stay in. If you are used to them coming to you all the time and giving you cuddles, etc., and they're just not doing this for a day, that could already be enough for them to actually have a disease. And then the problem is because they're so small, because they're so not easily palpated by vets. For example, if you compare to a dog, we can palpate the abdomen. We can already feel different things. We can already feel the kidneys. We can feel the liver. We can know if it's too big, if we have certain masses, etc. We can already know things on clinical exam that are very subtle, very complicated in birds because they're so small. Half of their cedum, which is the abdominal cavity, thoracic abdominal cavity, half of it is kind of covered by this keel, the big bone that they have. So we have a small space in the back to actually try to palpate stuff. So if we have very obvious things, if we have a huge egg or a huge mass or a liver that's way too big, we might actually be able to feel those things. But there's multiple cases where we try to palpate, you don't feel that much, and then you have to go to diagnostics like bloods or X-rays, etc. So parrots are very complicated because when I get them coming in, and then the people they say, oh yeah, they're lethargic or so low in energy or they are not breathing well, it can be multiple different things. Not breathing well can come from an egg being stuck in a parrot, which has nothing to do with the respiratory system. But if the egg is stuck, because they don't have a diaphragm, the egg can actually crush their air sacs, which are little pieces of lung that they have inside of them. I'm using quite scary words, I would say. And they might actually just like collapse, make their whole respiratory system collapse. So that's just by an egg staying really stuck inside of the abdomen, which has nothing to do with the breathing issues. And then, when people are like, yeah, but he's breathing badly, I'm like, yes, it might be other things unrelated to the respiratory system. And that's absolutely why we need extra stuff like the x-rays and the bloods, etc., which we might be way better at, listening to the hearts and the lungs of cats and dogs because they're way more, let's say, isolated and located in an animal. We can actually hear stuff way easier than we can hear in parrots. So even as a vet, it's very complicated to diagnose just with a base physical exam. Even though we might have ideas, we might have to go further in diagnostics to understand what's going on.
Oh my goodness. It's so complex. It is
I just
literally
shocked
so
you,
complex. Yeah.
right?
Um, I think that this is exactly why it is so important that as parrot owners, we go for checkups, even when they're healthy. I go
Yeah,
with Mia semi-annually. The original information I got was, at least you should go annually, but I like to go twice a year because a lot can happen in a
yeah,
year. So, do you think that it's important to go for those, checkups? And
absolutely. Yeah.
what kind of testing should we be doing with our pet birds on these annual or semi-annual health checks? And how often does a healthy parrot need to do blood work? Because I'm so nervous about blood work. And you mentioned blood work, and when they're sick, it's like you have to. And I saw
Yes.
that video you did where the needle is going into the side of the neck, and that's the jugular vein. And I was like, oh my gosh. And then I think about, but that was like a big bird. And then I think about like a budgie or a conure. I'm like, they're so small. What if you,
Yeah.
like, like it just makes me so nervous. So tell us about the blood work
Yeah.
and the
So
testing that we should be doing.
it looks scary. I can understand this. So basically, if the animal is kind of nice to handle and quite chill, and we have like people that can hold them properly, etc., then it can actually be done without sedation. It looks a bit scary because it's the jugular vein, and we kind of like we see this as, oh my goodness, a needle going into the necks. But for example, cats and dogs, we also go into the jugular vein often. You can do other veins. You can do cephalic, which is like in the legs, etc. In birds, we're a bit more limited because we need to have a big vein to be able to get a good blood flow. If the blood takes too long to come out, it might start to coagulate, and then you get biased results on blood. So you need to get a big blood flow. So we tend to go to the jugular. There's also other ones, for example, in the wings, sometimes it can be taken, but that can be a bit annoying, afterwards with the positioning of the animal. The legs also, they have little veins in the legs that we can use sometimes. And blood rise. So there was a very big misconception that was going around that said that if a bird loses one drop of blood, it's dead. I don't know if you heard of these things like canary birds. I've heard this very
Yeah, I
often
think
before.
like a long time ago,
Yeah, so that's
this
not
was a
true.
misconception.
Blood volume depends on the mass of the animal. So the bigger the animal, of course, the more blood you will have in the animal, the more you'll be able to take blood if you want to. But
Mhm.
kind of like a way of seeing what the safe number might be is that usually we kind of say that 1% of the body weight of the animal is really the percentage that you do not want to go higher in. That's kind of like the really limitation that you do not want to exceed. So, and when I'm talking about this, to give you an idea, for example, 1% of a 100 milligram animal, that would be 1 ml. That's kind of how we count these things. So 100 milligram, a 100-gram bird would be 1 ml that we can take. So in African greys and, eclectus or Amazon parrots, you can go up to 3 ml. But that's kind of like the things that you do not want to exceed. So the smaller volume you take, the better it is.
Hmm.
And then when it comes to actually blood sampling, problem is that the more blood we have, the more tests we can run with the blood, because that's just the limitation of the machines themselves.
Yeah.
Yeah. So
Okay.
the problem is that when we have smaller birds, even if we can take a small drops, that can actually already give us a bit of information depending on the machines that we use. And if we can't use the machines because they have a limitation of the volume that we need, we can still make a small slide, for example, and look it up on the microscope. And that small slide can already give us an idea if you have enough white blood cells. If you have too many white blood cells, that might be an indication of an infection going on inside the body. If you have enough red blood cells, or not enough red blood cells, and that might be an indication of anemia. That could also already indicate multiple things. For example, the beak and feather disease, Peter beak and feather disease, which is caused by a circovirus. It's actually something that can have then an impact on the beak and the feather. Hence where
Yeah.
the name comes from.
The
But it's
immune,
also
I think.
something, and the immune system, that's it. And then the thing is, for example, African greys, young African greys tend to be very predisposed to developing their immune system crashes with this. And a thing that we can already do is, even if we have a small drop of blood and we look it on a slide, if we don't see any white blood cells whatsoever, that's already a very bad indication and a high indication that you actually might have circovirus, because the immune system is non-existent. There's no white blood cells in this animal. And that basically prognosis is very bad. Even if you don't test for circovirus, for the cytosine beak and feather disease, at that point, you already have a high indication that this might be what's going on. Not 100%, otherwise it would be way too easy for us and we wouldn't have to do all of those extra tests. But so bloods, even small volumes, even a few drops can already give us some information. And yeah, what I would recommend is, yeah, I highly recommend the yearly blood sampling test. I know it's scary, but if they're not handleable and if they're very crazy, which can happen sometimes, we have a way of giving them a bit of gas, which is something that actually makes them go to sleep for a few seconds and it wakes them up after a few seconds, and it's enriched in
Okay.
oxygen, etc. So this is possible if you don't want them to freak out and to flap around, and which can be a
Yeah.
risk. But we still go into the neck, so it's still a
Yeah.
small risk. There is a way of giving those kind of things. And if then at some point, for example, you need to do x-rays anyway, x-rays on a bird, it's usually you have to anesthetize them anyway with that gas to do it quite quickly, because you have to place them in positions that they wouldn't be in naturally. You can't ask them to be in those kind of positions. And then you
Mhm.
would have the wings overlapping. You wouldn't be able to look at the respiratory system that well, etc., etc. So yeah, I highly recommend this because like we said, they're so good at hiding disease. And even a healthy animal might be becoming hypocalcemic because the nutrition is not proper, might have liver values that start to increase. And then when we palpate, we don't necessarily feel an increased liver in volume because it's the beginning of the disease, but we might already see those kind of things in the beginning with the blood values. So these are really interesting things to pick up. If you do every 6 months, you don't necessarily have to do it every 6 months, especially if they're healthy. What I recommend to people is actually to weigh them regularly. Even if you can, weigh your
Yes.
animal every week because they're so good at hiding disease. They're so good, even small grams in small birds. If they're losing this, that could be already a massive trigger for you to go and consult with a vet. And that really helps you to be proactive and be on top of those kind of things. And then the thing is, if you take an animal coming from a pet shop or a breeder or wherever it comes from, especially if you have another bird inside of your house, make sure that you test for certain diseases. So the psittacine, the beak and feather disease, which is a circle virus. There's also another thing. So the Borna virus, which creates the proventricular dilatation disease. You might have heard of these ones too. This
Hmm.
is also something that if they have it, and especially if you have another bird at home, do not put them in contact because these kind of things are transmittable and they can actually they end up killing animals at the end.
And that's an issue with like the digestion. It's like they're starving to death even though they're eating or something like that,
Yeah.
right?
So Borna virus is something. So the proventriculus is the first part of the stomach, let's say in birds. And then
Hmm.
the thing is that actually ends up being dilated because it's kind of like a neurological disease, and it doesn't help it contract properly. And so they're not able to digest properly, and they end up starving to death. They can regurgitate. They can have neurological symptoms also developing that has not necessarily anything to link to the digestive system. Again, kind of like very vague, right? Neurological symptoms might come from diet, might come from this virus, might come from cancers, might come from, it's like it's very vague in them. So we have to do like extra testings. But these kind of things, yeah, if you have them, if you get a bird that is positive for this and then you get it in contact with an animal that's negative for these kind of diseases, you have a risk of transmission. And then
Very
the ones that
contagious.
yeah, and then the ones that have the virus, if they end up transmitting it, that doesn't mean that 100% they're going to develop the disease, which is the PDD, the proventricular dilatation disease. But it is a risk. And if they get it, unfortunately, for now, we do not have a treatment. It's only supportive care. It's kind of like anti-inflammatories that we can give that can kind of make their lifestyle as comfortable as we can. It's supportive care, but it's really, we do not have a definite treatment for these kind of things. Yeah, same thing with the circle virus. Circle virus can also, we do not have a definite treatment for it. Yeah, so these kind of things really test beforehand before you get a burden, before you put them in contact.
So if they get diagnosed with any of these, then it's basically for life and just basically finding a way to make them live as comfortably as you possibly can.
Yeah.
Um, and if they do test positive, does that always mean that like it could spread to your entire flock?
Not necessarily, because for the PDD, there's still a lot of research going on, particularly on knowing exactly how it gets transmitted. For now, like the hypothesis is that it's being transmitted through the different feces and even sometimes excretions coming from, like the regurgitations, those kind of things. There's some evidence that it might also be transmitted from a bird to a baby, even through the egg. So there's already that's kind of like the evidence that we have for now, but it's not 100% at this point. I would say like don't take the risk because it's not
Yeah.
100% understood now at this point. So do not take the risk. If you have an animal that's positive, unfortunately, get it rehomed somewhere else. Like it can still live a proper life. It doesn't mean that it's going to develop that PDD. If it has the PDD, then it's a poor prognosis. But if it is just positive for the Borna virus, it doesn't mean that they're going to 100% develop it. So it's potentially a bird that's going to live a normal life, but it should live a normal life, not in contact with other birds, because otherwise you're taking a huge risk.
Yeah. Because
Yeah.
sometimes I've also heard that they can test positive but have no symptoms or show no
Yeah.
symptoms.
Yeah.
So I think, and what I liked that you said in that post is that these are things that every parrot owner should know about. Like these are terms we should know. These are
Yeah.
things that we should be able to understand what maybe the signs might be or the symptoms, and something that we should be testing for every so often, because sometimes they might not have symptoms, but they might have it, especially if you're thinking about growing your flock or adding another bird to your home. Like the quarantine, the disease
Yeah.
testing, like all those things are so important, because bringing a new bird in, like you could be bringing in risks for your current flock or your current bird. So really important to know those things and understand them. Um,
Yeah.
and like what, as a vet, what does better management look like for birds that are diagnosed with, say, bornavirus or PDD?
It's a kind of a case by case scenario. Better management. um, just keep good hygiene at home. Make sure that you have enough, air going through your your room. Make sure that the humidity is adapted to the animal. Make sure that they have proper nutrition. Just like the base stuff that they need. That's like what you're the best that you can do. The
Yeah.
problem is that then if they don't have the disease, they don't show any symptoms, just weigh them regularly, make sure that they're not losing weight, etc., etc. If they start to have symptoms like regurgitation, for example, then it's quite complicated because, like I said, we don't have a treatment for it. So the food might need to be supplemented with a bit of force feeding, what we call like syringe feeding, in small quantities to make sure that they get some foods going in. You might have to occasionally give some fluids if they get dehydrated. There's like different things, but it's really a case by case scenario. And then unfortunately, if it gets to a point where they cannot hold the food down anymore, their welfare is not, it's not there. Well, then euthanasia is technically like an option that we can do because we don't want them to suffer, knowing that the end of the disease is actually those kind of, yeah. That's how
Yeah.
it is an option to keep in mind.
So, okay, we know that these viruses are highly contagious between birds, and I've read that it could just be from like their feather dust or like breathing the same air, like that's how contagious it is. So it doesn't
Mhm.
take a lot for other birds to get it. So it's contagious from bird to bird. But if you have like a solo bird, then is it something that you also have to worry about? Like, what are other ways that our birds can contract these viruses other than from another bird, or is that the only way?
It's not the only way. I'm going to freak out a lot of people. Basically, if you go outside and you're in contact with another bird, you can be a transmitter of the disease sometimes. So if you have been in touch with an animal that might have had the symptoms and that was excreting the virus for different viruses, you might actually be bringing it back home. So
Even though
if
you
you've
just like
been,
held, they perched up on your hand?
it's possible. Like you said, some
Wash your
diseases actually,
hands.
yes, some diseases might actually be spread from the feather, like the dust on the feathers, or even you've been in touch and you've been in touch with a small amount of the feces or something, you might actually already bring some diseases at home. Something that's quite transmittable too is, like for example, like the bird flus, those kind of things. You can actually be like not a carrier because you won't necessarily have it, even though humans can get the bird flu, but you might actually have been in contact with and then basically bring it back home. So if you think that you've been in contact with other birds or you know that you've been in contact with other parrots specifically, just wash your hands well. And ideally, especially if that one had symptoms of whatever nature, just like change your clothes completely, go and shower and use alcohol, the hydroalcoholic gel on your hands and those.
Isopurple.
Yeah.
I
Yeah,
love
it's
isopropyl wipes. I always like wipe down my phone and everything with those because I'm like, get all the germs.
yeah. Yeah.
I've read too much about parasites and bacteria, and so it's like always in the back of my mind. I'm like, I can't see what's on this, but you might be on there.
So yeah, you don't have to become super stressed about the whole world because
Yeah,
you are part of the whole
just
world,
other
etc.
birds.
Just make sure that you know the basis of, the different cares and the things of the risks that you might bring in, and just make sure that you mitigate the risks as much as possible. But don't become like, I need to sterilize my whole house. That's not
Yeah.
necessarily something that you need to do. But yeah, it's something that even there's a thing called psittacosis, which is actually, I don't know if you've heard, is chlamydia. It's not exactly the same chlamydia as what we necessarily get, but it is transmittable, for example, from parrots to humans too. And that's
Yeah.
something, so yeah, they can also, yeah, we can be not carriers of them. We can get them, so it's called a zoonosis, but we can also kind of like by being in contact with other birds actually transmit it to them, etc., etc. So yeah, make sure
Yeah,
that you,
we've spoken a little bit about that on the podcast before with Dr. Octavio, and we went into that. So yeah, there's so many things that can be, really contagious for our birds. And so those avian vet checkups or exotic vet checkups are really important, and also doing the screening and the blood work. Mia, you're gonna have to do blood work one of these days. I don't know if I can watch. I'm gonna be like, make sure she's okay.
well, if you feel stressed, like for the vets themselves, maybe go
Yeah,
into a
for sure.
different
I
room.
totally understand.
Because if we have people on top of us and being like, "Watch out, you're hurting," it's very
Yeah.
complicated for us to do our jobs, and that might actually transmit also stress to the animal itself, and that we're struggling to do our job properly. And also, birds
Yeah.
sometimes behave differently if they are in contact with the owner or if they are out of contact with the owner, like if they are in a different room. It's not just birds; we've seen it also with dogs and cats. Sometimes they want to snap at us, and then we just take the owner out of the room, and then the kind of protective behavior that they might have towards the owner kind of like goes away, and then we can actually work on them. It's not that we want to
Yeah.
hide what we're doing, because some people are like, vets are like hiding what they're doing. That's not necessarily what's
No,
happening.
for sure.
uh,
I
but
totally
we like, yeah,
understand that. And
yeah,
there was a post that I had read from you, and it broke my heart. Because you talked about how when you were a little girl in Mauritius, your dog was hit by a car. That makes me so emotional. I don't want to cry. And you weren't able to get the help, and you had all of these frustrating feelings afterwards because you felt like the vets didn't come to help you
yeah,
in a time of need. And it's your dog, like you love your dog. Like I understand that bond, so it made me really emotional reading that. And then you went on to talk about how sometimes we, on the other side of the vet, like the pet owners, we don't understand how vets are feeling. And I had no idea the suicide rates of
yeah,
vets, because you want to help so much and you're always dealing with the animals that are sick, that are injured, that are in critical conditions. And it's always like emergencies or needing to help. It's never, like you said, like, at the zoo or conservation where you're doing preventative care. It's not preventative care. And so I want to take a moment to, show that appreciation for you and all the vets out there and everything that you do for our pets and animals, around the world, because there's so many vets around the world, and, the stress that you have to deal with. And I've seen, videos of vets before where it's like, your heart is sinking because you have to go in and, for example, perform euthanasia, and you have to stay strong for the owners because they're losing a member of their family. And it's just so hard because as regular people that aren't vets, we don't see what you guys are going through and what's happening, in your hearts and behind those clinic doors. So I just want to take a moment to, say that we appreciate everything that you do. And I totally understand that, you guys are
yeah.
doing the best that you can. And there's so many different animals that are coming through you to you as patients. And there's, so many different case scenarios.
Yeah, it is a not nice topic what at all. Every vet I know, all of my friends, all of us, including me, we've been through a burnout at some point in our career. So it is a massive, massive problem. Unfortunately, like the numbers are very scary, and I know them directly, is that vets are the world champions when it comes to suicide on this planet. So, and the numbers are basically vets tend to commit suicide about 4 times more than the general numbers and the general public. Yeah, 4 times more. So they've been trying to study it and kind of understand what drives this. So one of the reasons they explained is that, okay, like vets have access to euthanasia, so it might be easier to actually go ahead with it. But the thing is, they've compared it to other people, for example, human anesthesiologists and dentists, etc., that also have access to anesthesia / if you overdose, euthanasia. And the suicide levels are not the same. So there's something else in addition. So a lot of people actually think that, yeah, the euthanasia might be a big problem. I personally, and I know of a lot of vets that, of course, we don't like doing this, and we see the pain that it causes in a lot of people, and we feel and we relate. I've had cases of euthanasia where I was euthanizing animals. One of the worst ones, for example, the person had lost her husband, and that was the animal of the husband, and that was the last thing that the person had that linked her to the husband. So when you have those kind of things happening, you're really trying to be strong. It is not fun whatsoever, and you try to be there as much as you can for them, but also for the animal that's passing, and it's very complicated. But usually when these euthanasias happen, that means that the animal, there's something that we cannot treat anymore, and there's like an end life stage disease. So we can also kind of relate to the fact that we're helping them passing on, and we're helping them stop the suffering. So that's kind of like the thing that makes us a bit positive, if we can say, to that situation. But the problem that I personally had to deal with, and many vets have to deal with, and that's really a redundant topic, is, for example, yeah, people coming in and then they're very emotional because of they might be losing their animal, but it's not necessarily linked to the fact of them losing animals. We've had people, for example, if you cut the nails of an animal, and then the nail is black, and then you get into the small part where they might bleed a tiny bit. Some vets have been bashed online because the animal bled a tiny bit, or other things. For example, we're busy with an emergency, and then people come in and they say that their animal is also an emergency, which sometimes is, which sometimes is not. We've had some just people because they're very emotional to it, and then you can't take them directly because you're in the middle of an emergency surgery or whatsoever, and then people have been bashing vets again. It's just like sometimes for very things that they think is important, and they see their case with their animal, and they don't realize all of the other things that are going on there, and then we sometimes get bashed. And the argument that is very redundant is vets only care about money. And that one really digs, like that one really hurts, because we've been discussing right now about all of the different diseases that they can have and how good they are at hiding symptoms, and how much basically testing is important, because just by seeing an animal, we might not be able to just guess what's going on. And all of this tests cost money. All of those, the analysis for the bloods, the machine itself costs tens of thousands of dollars. The machine, the X-ray machine, tens of hundreds of thousands of dollars, etc. And then you have to pay your employees, you have to pay all of the consumables, the medicines that you use, etc. So it is a whole big topic. But when we just get called, you just like money and this is it, you don't care about the animal, that really hurts, because the sole reason why we go into becoming vets is because
you love animals.
That's exactly it. And then we end up seeing suffering, we end up seeing people that can bash us, those kind of things. So it is very complicated. And then the problem is also basically, we might have a whole day where we have beautiful, like very nice people, very nice interactions with people, very nice animals, and then you have that one case coming in. And the problem is that we focus on that one case, and then kind of like we make the day into a negative day while it wasn't one, but we focus on those kind of things. It's a very complicated topic. I've had nights where I wasn't sleeping because I was concerned about the animal I had just done surgery on, or because I had started treating a critical animal, and it was like, is there something else more that I could do? And then you spend time reading stuff, and even if you know that you've done everything you can, sometimes you're like, it's just like we get emotionally invested in these animals. So yeah, it's the bashing that's quite a big problem. And the problem is that the bashing leads to So burnout, suicide, etc. And then the thing is, it also leads to vets not wanting to be vets anymore. I've seen some stats too, where basically they said that I think one vet out of three in the first year of starting to work as a vet does not want to be a vet anymore. So 1 year of working and you don't want to anymore. And then you get to a position, for example, in the position I was in with my dog, because that's the beginning of the story here, is that I was living in Mauritius. There was one vet available, and that vet was out working on another emergency. My dog had he had problems because he had been hit by a car, and it was complicated to get him out of it. But we stood there in front of his clinic for almost an hour, and my dog ended up dying a few minutes before he arrived. I don't think he would have been able to survive to save my dog at that stage, but I was there, trying to help my dog. I'm sorry, I'm making you cry. I was trying to help my dog, but I couldn't. And I just the message is basically I that's what made me become a vet. But the message is please be nice to your vets because if you drive vets out of practice, you will end up in a situation where you might be able to save your animal at some point, but because the help is not available, you might not get it. And the less vets you get, the more people will become annoyed because the vets are not available. The more people will potentially bash vets and talk about them in a very not nice way. And the more vets, the more that will lead to burnout and then people not wanting to work in this field anymore. It's not because we don't like the animals, we love the animals, and that's what basically drives us to feel that emotional about it. It's a not nice topic, but it's an essential topic. I thank you for talking about it, and I thank you for the kind words that you have. But it's really something that should be talked about, not for people to pity the vets, but basically just understand the vets. And if you see a vet and you come in for a general health check, and the vet is like, "Oh, how's Kiki doing today?" etc., etc., just know that that vet a few minutes before might have euthanized an animal, or might have lost an animal under anesthesia, or might have or might have had to talk to an owner that just lost its pet, and that was the link to
Yeah.
assessment, etc., etc. So these are real situations that we face every day, and it is, yeah, it's not always easy.
Yeah, I can only imagine. Like the way that I look at vets is I'm like, you guys love animals. That's why you're doing what you're doing. And I also like think that, everybody is going through something. You never know someone's
Yeah,
story or their origin or what they've been through or what happened to them yesterday or this morning. And so it's just important to be kind, but
yeah,
also, you're coming into somebody for help for a family member that's maybe furry or feathered or scaly. And it's just so interesting to me that people are like, oh, vets are all about money. But nobody bats an eye and says that doctors are about money. You guys are just doctors for animals. So
yeah. The difference is
what about
basically,
doctors? Aren't they doing it for the money? No, they're doing it to help humans. And
yeah.
vets are doing it to help animals because they're animal doctors.
I think some doctors, depending on which field you work, can also get bashed for those kind of things. But the difference is here is that for example, people don't necessarily always have insurance for their animals. And there might not be insurances for those specific animals because the few insurances that actually exist are usually focused more on cats and dogs and not necessarily on exotic animals. So the problem is that the people see the real cost of medicine. And it's not even the real cost of it when you think, because like the numbers that I saw too, that I've had some comparative numbers that I saw passing, which is that vet medicine tends to be a minimum of 4 times cheaper than human medicine. So, for example, if we do a C-section on a human that needs to deliver a baby, and we do a C-section on a dog, on a rabbit, on a just name it, basically, we are going to be a minimum of 4 times cheaper than what the same exact surgery, the same anesthesia, the same monitoring devices cost, etc. That's going to be 4 times cheaper than for a human. So we are cheaper. It's just that because people see the full amount and they don't have the insurance
Yeah.
behind it, they tend to be like, oh, this is so much. But the problem is that also if you try to look for a cheaper vet, because cheaper is not always better. I'm not saying that the vets are not worse or whatsoever. It's basically if a vet asks for less money for one specific surgery that then another vet might ask more money for, there are differences in different clinics. I'm not saying that it's all, just linked to these things, but
Yeah.
basically a vet can be more specialized. So if it's a specialist, you need to pay more for a specialist. They have been doing more studies for it. So you pay more for this. There might be way more equipment when it comes to the monitoring of the surgery itself. There might be for different birds. For example, like we might like to have a respiratory device that actually makes them breathe automatically during the procedure. If you go to another clinic that doesn't have this, because they might not have the means to get it, but if you then the procedure might be cheaper. But just be aware that if you go just for the cheaper one, you might actually not get a specialist, not get a person that has a lot of experience in those species. You might not have the equipment to proper monitor and make sure that the procedure is as safe as possible, because it's still a procedure that has risks. So paying more can also, in the majority of cases, be because you're paying for more monitoring and more skills and more equipment for your animal, and which increases usually the safety of the procedure itself. So I understand that usually it is a lot of money, so you try to go to kind of like what people can afford. But yeah, be aware of these things, is that it's not just this one is cheaper, so it's better, because it's not always how it works.
Yeah. And, with parrots, this is why I also love what you're trying to do and focus on preventative care and educating people online about preventative care, because parrots in general, or even exotic pets, I mean, I don't know about too many exotic pets. I had a lizard for a little while when I
Yeah.
was younger, and I had a turtle, but in my adult life, when it comes to parrots, I have noticed that they are not cheap pets, even though
No.
some people think like, oh, you just need the small cage and a bag of seeds and the bird and their decor. They are expensive because there is a lot of things we need to get for them. But over time, it gets a little bit less expensive. In the beginning, you got to get the cage and toys and purchase and all these things. And then after you're, just buying things here and there. But when they
Yeah.
get sick and you go to the vet and you have to pay those vet bills, I have seen some people's vet bills after, a toucan or a parrot went to the vet, and I'm like, oh my gosh, like it's in the thousands. And
Yeah.
that's when your parrot gets even more expensive. So it's
Yeah.
better to focus on preventative care so it doesn't get that expensive.
Yeah, yeah, absolutely. Preventive care is always going to be cheaper than the when we have to intervene on them. And yeah, the interventions can cost thousands. If we have to do surgery, if we have to do, hospitalization for, sometimes it can be a few days, sometimes it can be weeks of hospitalization that's needed with, regular feedings, IV fluids, etc., etc. So these things can become very expensive. So yes, focus on this preventive care, because if you give proper nutrition and you have a good husbandry and you don't have things that lead to behavioral issues, etc., that will prevent so many different diseases, and then you will not have to pay those thousands of, it can always
Yeah.
happen, you're not like, an animal can develop cancer, etc., something that you could not have done anything about. But honestly, it's not an exaggeration. I kind of tend to use that number a lot on my social media, but it's more than 90% of all of the exotic vet cases that I see are linked to nutritional husbandry. So 90%.
That's
It's not rare, it's all
crazy.
the time. Parrots, it is like the seed diets, it is the cages, it is the, sometimes, something is also they don't have access necessarily always to natural sunlight. So like giving them like a UVB light or something is also something that can actually help them. That's for the parrot side. On the other side, for example, the reptiles, they are very expensive in the beginning, because you need to have a whole setup for them. You need to have specific lights for them. You need to have devices that actually monitor the temperature, the humidity, etc., etc. So it's a huge investment. If you don't get this from the beginning, it's going to cost you thousands afterwards in vet care, and that doesn't even guarantee for them to survive. So
Yeah.
invest those hundreds of, you know, that you need in
Yeah.
the initial nutrition and the initial setup that you need, and try to keep always a bit of money just in case you need to go to the vet. So if you don't have access to an insurance, try to monthly, put a bit of money aside and put that in on a trust fund, something, to
Yeah.
make sure that you have a bit of money if you need it then afterwards. But yeah, not you would already avoid all of those 90% of cases that we see regularly, that just come from, yeah, inadequate husbandry, inadequate nutrition.
Yeah. Okay, we'll move topics very soon, but while we're on this, from a veterinary perspective, I want you to tell us, like, what does doing right by our birds at home actually mean, especially because there's so much information online about parrot care, and not all of it is accurate. And, sometimes people are trying to be experts in parrot care when they're not. I've seen this like trending reel where it's like vets or other professionals are like, why are you, on social media, sharing information? And it's like, because there's influencers on social media trying to be like an expert as a vet or,
Yeah.
whatever the profession. So, tell us, like, what is the most common pieces of like misinformation that you're seeing online? And from your advice, like, what should we be doing at home to do better by our birds and make sure that we're being preventative in all of these different things?
So, be you need to know the species that you have, and you need to know exactly what the needs of that species are. So if you read up just on general topics on parrots, you might, get recommendations on foods for African greys that might not be what a conure needs or a lorikeet needs or something like this. Like nutrition wise, there's already difference in there. Make sure that you get in touch with an avian vet for the parrots that actually can recommend you specifically for this animal what you have to do. And yeah, I've seen that trend too. I actually really liked it. I was kind of debating if I need to do a video on this too, but then I've seen a lot of vets doing it. I was like, no, it's going to sound redundant. But I really love this. It was like, yeah, why are vets trying to be influencers? And then they said because
Yeah.
influencers are trying to be vets.
Yeah.
Yeah. And it's real. But the thing is, so yeah, there's multiple things that you actually might need to take care of. We just started speaking a bit about the UVBs. Yeah, as many people actually they take the animals in and then they actually don't necessarily know that they need sunlight. So the best sunlight that you can give them is real sunlight and not through windows, because many people think that the sunlight comes through the windows, but it's just the heat. The UVBs get stopped through the windows, and that's
Hmm.
kind of like very important already for their feather health, etc., etc. It's the feeding. So we already covered this. Is like make sure that you actually adapt it to what they need and make sure that you adapt the foraging and that you give them the opportunities specifically for them. Husbandry wise, make sure that the environment is proper. So this just like get a bigger cage or whatsoever is not really what you need. You need to spend time with these guys, so be ready to spend a lot of time with these guys because again, it's a child. Take care of them as a child and not just spending just time with them like this. Actually invest yourself in clicker training or in recall training or in target training. If you don't know what this is, like read it up or look it up on YouTube. There's a lot of different videos for those kind of things. Spending time with them is going to enrich their lives and is going to not make them into circus animals, because some people are like, yeah, I don't want him to be a circus animal, but just like spending time with them and learning those tricks can help the vet care too. You can actually, if they have like an overgrown nail and then you need to kind of file it down a bit, if you train them to do this, then you remove all of the stress and you already avoid of different stresses that then lead to diseases. And then just kind of be aware that multiple things actually that are common sense sometimes in exotic pets, or if people tell you that this is what we've always done, so this is what works, is not necessarily true. And also that basically there's a lot of things that we still need to learn about these exotic pets. There's like new research coming out all the time. And yeah, some of the common things that everybody has done all the time has actually never been studied. So make sure that you kind of like read up as much as you can and not necessarily forums. If you're a person that likes scientific articles or you know how to read a scientific article, just go ahead and try to read these ones and then just chat with your vet, basically explain different situations. Medicine is not 100% pros, 100% cons. It's really like you need to understand what is beneficial or what is a risk for the animal if you do certain things. And these things are not 100% this is going to work for that kind of species. It needs to be adapted to the individual that you're taking care of. So yeah, make sure that you chat with people that have a lot of experience, but also make sure that you read up on the scientific papers that you can find. But it is it
Amazing.
is complicated.
Yeah. That's why it's important to, like you mentioned in the beginning, that you really need to get to know your species. Like if you get a lorikeet versus like a conure, like their diets are drastically different.
Yeah,
Lorikeets need like nectar and fruit
nectar.
and
Yeah,
completely other, way more fruit than, a conure or a macaw would need. So yeah,
yeah,
and even like the size of portions that you're feeding, like Mia compared to a macaw, the portion sizes are going to be very different. You can give a macaw, for example, an entire walnut and they'll crack it open. If I give her an entire walnut, she's not going to crack it open. The only thing she's cracking
Just
open
go to
is
look
like
at you, she's like,
sola
what?
or balsa wood or seagrass,
Yeah,
So
yeah.
you have to know your species and, those were all really great tips and things that we should be doing. We've also talked quite a bit about like social media and the trends and the things going on. And social media has massively grown the parrot community. There's more and more parrot pages popping up. But from your perspective and where you stand, do you think that social media has helped or harmed parrots' welfare overall?
I think in general, it has harmed more than it has helped at this point. It's getting a bit better, I would say. Like, for example, you exist. Different different pages are trying to talk about, the impact and the impact of social media itself on the animals and try to kind of like raise awareness of those kind of things. The problem is that if it has hurt the how people take care of them, it's not necessarily that people specifically wanted to hurt parrots, not at all, but it's just that they were happy sharing videos, cute videos of their parrots,
Cute,
etc., etc. Yes,
cuddly,
because you love those kind of videos, and everybody loves those videos. That's why they're so
and they go
popular.
viral. And then
Yes.
everyone's like, I want a bird.
And that's the problem, is that initially it's not necessarily social media problem. It's just basically people wanting to jump on, oh, this looks cute, I want one, without necessarily doing the research before or being influenced in a negative way. Like, yeah, you go to pet shops and then they might tell you, oh, this is a good beginner bird, or this is an easy one. It's very easy to deal with these guys. And then you don't know what it is to have one. For example, I don't want a parrot. I love them. I love to take care of them, etc. I don't want one, and I couldn't take care of them properly here, because they poop everywhere. You know this. For example, they're very dirty. They can be destructive. They can be very vocal. If you don't take proper care of them, the more you kind of ignore them, the more they might become vocal. And then
Yeah,
the problem is that parrots are there are many species that get abandoned, but parrots are one of the top ones of species that get bought. And then in the first year, a majority of parrots people get rid of them. They
yeah.
rehome them. Worst case
Put them up
scenario,
in
they release them in the
rescues.
wild, or
Yeah.
yeah, those kind of things.
Or
Um, yeah, so it is a massive problem. And the thing is that if you just base yourself on social media and how cute they look, which is true, they look cute, you might get negatively influenced and you might have ideas that are not necessarily true.
yeah,
So if you really want
unrealistic.
a bird, yes, if you really want a bird, read up on it, but also get in touch with people that have birds. Try to see if you can go and visit people that have birds and what the setup should be, how much cleaning this is, how much time you have to spend with them. Ideally, you should actually have more than one bird because they're very social animals. If you only get one, they get attached to you, and then you have your life. You need to go out, you need to go work sometimes, you need to, yeah, you can't be 100% with them, but you are their whole life. So if there's not, multiple other animals, that might also lead to, behavioral issues, etc. So it's a whole big problem. That yeah, and then it gets interlinked again, with the conservation problems, etc. And then it is an issue. But
Yeah.
yeah, yeah,
I
yeah. That's
totally
part of
agree. And I actually saw the post that you did how, you get one and then you think like it's fine. And our history is we had a sun conure and now we have Mia. Our sun conure wasn't able to join us because we had lived in a different country and moving and traveling
yeah,
with parrots is completely different than
yeah.
with like a dog or a cat. Like it's a lot harder and
You
there's
need
like
CITES
no,
documents, etc.
yeah, so many
Yeah,
documents, but also
yeah,
airlines. There's like no airlines
yeah,
that take parrots, especially in cabin. That just doesn't exist. So,
yeah,
yeah, but I have thought about like a companion for Mia, but everything that we're talking about and even like everything we talk about on this podcast, if I knew, I'm gonna be really real here, if I had known everything that it takes, to have a parrot and the responsibility and the care and everything, I don't know if I would have, said I want to be a parrot mom because it is complicated, it is complex, and even like with travel, it's hard to figure out what to do because a lot of people are scared of birds or not used
Yeah.
to birds. They don't know how to care for birds. Everybody will jump to, care for a dog and dog sit. But with parrots, it's a lot more complicated. And if I knew everything that I know now, I don't know if I would have made the same choices. And that's just,
Yeah.
the honest truth. And so then it gets a little bit complicated, like you were saying, the screaming, the pooping, and all these other things. And then also, like, if you like to travel, or depending on like your lifestyle or your work life, and all these different things are things that you need to consider because yeah, having a companion for your bird, I think, is a good idea. But because of how complicated it can be and everything that I know, because then I'm like, it's double the loudness, it's double the poops, it's double the mess, it's double the, a lot of different things.
Yeah.
And, I want you to talk to us a little bit about, having solo birds versus having like a pair or a flock and like what your recommendations are, especially if somebody has like a complicated situation and they have one bird just like we do. Because I see a lot of, social media influencers that have one bird, and I try to do the best that I can for Mia. And this was not our intention from the beginning. From the beginning,
Yeah.
it was supposed to be the two of them, but it ended up being just her. And I'm hesitant to add to the flock because there's so many things that we'll have to do, and there'll be the quarantine and disease testing. And I want to be really responsible about it, and like the slow introductions, and will they get along? Like there's so many questions that you have in the back of your mind and how it's going to work out. Like you just
Yeah.
don't know.
And it's not guaranteed that the other bird that you would like to take in, like you said, is actually going to go along with her because it's like humans too. It's like it's not because you put two humans in the same room that they will be the best friends. There's a
Yeah.
whole introduction thing, and then they might like each other, they might not like each other, and then anyway, you have a second bird, and you need to take care of these kind of things. And if they don't like each other whatsoever, then what are you going to do? Can you rehome one of the birds? Do you try to find accommodations or adaptations to so that they can kind of live in the same area but without injuring themselves because they can also injure themselves quite badly. It is a whole topic. The thing is, like, if you can't take another bird, for all of the reasons that you just said, it's basically you have to try to spend as much time as you can with your bird. Um, there's actually a thing that could be tried. I've seen some people try it, is actually to make like video calls with other parrots.
Oh,
So don't
we've done
necessarily,
that.
you've done it? Okay. So
And
don't necessarily,
I also play like Parrot TV for her. I actually created this like calm music, like of like different parrots in the wild. It's like a
yeah.
1 hour that you can play on like YouTube for your bird. And I play it for her all the time. She listens to it and she just like watches Parrot TV.
Yeah, so don't necessarily place them like mirrors because I've seen a lot of people like placing
Oh
mirrors, and
yeah.
actually that can be like a
That's
competition
frustrating
for
for
them. They
them.
don't understand. They're not having a social behavior, a social enrichment behavior with themselves because they don't necessarily understand. It's like this bird is doing exactly the same as what I'm doing, so that's not a good thing. But yeah, potentially the video calls and the videos could be a good option sometimes. It kind of gives them a bit of enrichment. I've seen some birds freak out with the videos and with the parrot sounds and everything. I've seen stereotypical behavior develop from those kind of things. So it's not because you
Interesting.
place it and you think that it's natural and beautiful that they will necessarily love it, but it's something that you
Hmm.
could try and kind of see if that helps them because then they hear other parrots, they can see other parrots. And if you have video calls, the positive thing about this is that you can actually have a real live interaction if they like each other. Make sure that they like each other because then they might look at each other, kind of interact and see, and what and that you can't do with like a YouTube video because it's just a random video passing by. But yeah, it's something potentially help it, but it's really mostly the behavior and the time that you will be spending with them because they see you as their flock. So make sure that you have positive experiences with them. Like I said, yeah, really spend time with them, training them, doing teaching them tricks. And when I'm talking about tricks again, it's not the circus stuff. It's just like stepping up, on your finger, kind of like seeing if they can give the paw one after each other, seeing if they're okay with spreading a wing. Um,
Hmm.
Seeing like the different toys, you try to see if they can place, a round circle on the round, whatever toy. It's a lot of enrichment for them, and it's mimicking behaviors, even if some people think that they're silly because they don't have this in the wild. It's actually mimicking natural behaviors of curiosity, etc. And they really need this. So there's no magical thing that you can do. You have to spend time with them. You need to enrich their environment. You need to make sure that if you're not there, that they have foraging opportunities, play opportunities, potentially video calls with other parrots. Yeah, so make sure that, yeah, there's no magical thing. They are flock animals. They need to have a flock. So, or it is you, and then you have to do whatever you can to be there and to enrich their lives with your presence, or it is with another bird. But like you said, you have to pay attention to the disease introduction, the quarantine, the behavioral introduction. That can be a problem. So there's no magical one way of doing those things, and there's no guarantee that it will work.
Yeah.
That's a
Yeah.
problem too. Yeah.
There's so many like moving pieces when you want to add a family member, whether you're planning, to have a baby or you're planning to add a puppy or a bird into your life. Like there's so many things to think about and consider. And like we've talked about from the beginning is just really getting to know that animal and providing them with the best care that you can based on their needs. So, yeah, maybe one day, but I do my best
And then
to
she will hate the other one, and you'll have a second problem, like you
yeah.
said.
And I often see like I don't know if this happens with birds too, but I often see people like get a second dog and they're like, my first dog is an angel, so they inspired us to get another dog, and then they get a second dog and they're just crazy menaces. And I'm like,
Yeah,
what if that happens if we get a
yeah.
second parrot?
Well, the thing is, you said that there would be more screaming, everything. That's not necessarily true, right? Because they might actually calm each other down, potentially,
Yeah,
because
but
they
they can
might be
also set
interacting
each
more.
other off.
But they can also make it worse, that's for sure. You need
And
to
then the
keep that in
neighbors
mind.
are going to be like, okay, why is it even louder than it was before?
Yeah.
We don't want any complaints.
Yeah.
Um, Okay, let's move over to your work in conservation and some of the experiences you have. You went to school at the University of Edinburgh in Scotland for conservation medicine. How
Yeah.
do you view the ethics of keeping parrots as pets? And is there like a responsible way to do it? And where does the line get crossed? I mean, I know with the illegal pet trade, like the line is crossed as soon as you poach a wild animal from the wild and bring them into your home. But what do you think?
Yeah, it's very complicated, but yeah, I've done this master, which is an extra master that I've done because I have the master in as a doctor in veterinary medicine, but then I've done this master, which is a master in conservation medicine, which talks about captivity, about transmission, about zoonotic issues, with humans, and then the impacts that humans have on the environment of the animals, etc. So it's a very big topic, and captivity, like again, I'm not 100% against, 100% for. I feel that everything depends on the situation you're in. For example,
Hmm.
many of these birds, they are in captivity. They have been captive bred. They have been born in captivity. These guys, you can't necessarily just release them. We talked about it quickly about the release of the animals and then the mortality, etc. And these animals that are being released are usually animals that have minimal interactions with humans since birth. They have specific feeding ways, and they have a whole training to go through to actually make them survive in the wild. So a domestic animal, even though they're not domesticated, if your parrot has been born in captivity, it's not going to behave itself exactly like a wild counteract. So this is kind of a big issue. You can't release them. So they exist in captivity. These guys, you have to take care of them. So my view of this is like, you can have them. I really encourage people to, if they want them and if they have read up and if they're 100% sure that they want them, which was the whole topic here, to go and adopt them, because like we said, there's so many people that actually buy them and then don't keep them even in the first year of them having them. So there's a massive amount of parrots actually on the market, which is not necessarily coming from breeders or pet shops, etc., that actually need a home. So if you really want one, I strongly encourage you to try to go and adopt. If you really want one and then you want to go and buy one, make sure that you go to specific breeders that would then specifically test for all of those diseases, that breed them in ethical conditions. Make sure that they grow up with different flock animals. Hand rearing is like a very common thing that is done, and it's actually wanted by a lot of people because then they have a special bond with the bird. But actually, hand rearing has been also linked with potentially an increase of aggressiveness in animals. And the more aggressive they become, sometimes the more easily they bite, the more easily they get rehomed. So yeah, make sure that they kind of like are raised with the moms if they can, and that they kind of grew up seeing other birds and kind of like growing up with the natural and normal behavior of these kind of birds. And then, yeah, but the one massive thing, especially in the vet world, is that make sure that you get these animals tested before you bring them in. Yeah, so that's kind of my view. I don't necessarily like everyone having parrots. I don't think everyone should have parrots. That's kind of my view on it. If you're not able to adapt your environment towards what the parrot needs, I'm not saying that you should have 10,000 toys and those kind of things. It's like you need to cover the physiological needs of these animals. If you
Hmm.
can do this and then you can adopt one, or I would say worst case scenario, or if you want to go and buy one, basically just like make sure that you can cover these physiological needs. If you work from morning, evening, you can't spend time with your parrot, you want to keep them in a cage, you I can give you an example. I've seen some people buying an African Greys. They had another one. That one died after a few years. They bought another one. The parrot had the wings that were taped because they didn't want the
Taped?
parrot taped with tape. That's kind of a
Taped?
yeah, it's still commonly done in
I have
various
not
areas.
heard of wings being taped, only
Yeah,
clipped.
clipping or taping, basically, that still exists. Yeah. So those kind of things. And then when I discussed with those people that that should not happen because you cannot respect the animal, it's like then they were like, I don't want my animal to fly around and I don't want my animal to poop everywhere. And then they were telling me, it's
Then
like,
don't
because you
get a
don't have a
bird.
parrot. Exactly. That's my answer. And that's how I can sound extremist and very extreme in how I say, but this is not extreme for me. It's basically if you're not going to respect the physiological needs and adapt yourself to the animal, even though the animal needs to adapt a tiny bit to the environment because it's not a natural environment. Really adapt yourself to the animal. If you can't do this, don't take this animal. If you don't want a flying animal that poops everywhere, that might destroy, take another pet or don't take any pet if you can't take properly care of this. So this is kind of my view on it. And if you have them because they are in captivity and because you get them from different areas or because you adopt them, yeah, make sure that you consider the husbandry, the nutrition, and all of these kind of things. Yeah, and otherwise, basically, like don't get them from the wild. That's really the thing. The problem is that also basically, if you get them from breeders or any other areas, try to make sure that you have paperwork for these, which is usually a minority of the animals that you can adopt, but make sure you have, for example, a CITES document. We talked about it. The CITES document is a
Hmm.
document that shows you if this animal could be commercially traded in the world, and that can actually be a document stating, okay, this one was born in captivity. If you don't have those kind of documents, then there's a risk that it might come from the wild, and there's a massive amount of parrots that are still being poached from the wild. And because they already have so many threats of different diseases, of their environment being destructed, deforestation, etc., like don't add on this. And just buying a parrot that might look cute, you might actually be contributing to this massive poaching issue. So yeah, don't do this.
When you were in school in Scotland doing your master's, did you also study wildlife crime investigation?
Yeah, we were talking about it. We had a topic about it on how to do necropsies and pay attention to the environment and the hints and the tricks that might like lead to you thinking that this animal might have been poached, etc., etc. So yeah, we had a topic about it.
Can you tell us a little bit about like the illegal parrot trade and what people might not realize about where some of these pet birds come from? And I also want to quickly also say like sometimes I see these videos on social media like they're all over on Facebook, on TikTok, on Instagram, and sometimes like in Indonesia or these other countries or India, and there's just these markets
Yeah,
and tables filled with tiny cages, and in each cage there's tons of birds, and it just breaks my heart to see this. And they're in this market just trying to sell these birds, and they're also obviously not vetting out like who's trying to buy this bird. Is this bird going to have a good life? Like they don't care. It's just money for them.
yeah,
And it makes me wonder when I see these videos, I'm like, are these, legitimate breeders? Are these parrots poached from the wild? Like, where have they come from? And these are no conditions for any living being. So it just like makes me feel so frustrated. Talk to us about it and calm me down.
I'm not sure I'm going to calm you down, Mr.
We're both
Tom.
gonna get angry. Let's go.
I am angry when I look at the conservation issues and I try to kind of calm me down. Sometimes it's positive, it's complicated to stay positive when you work in those kind of fields because you realize that, you know, it's not always easy. But basically yeah, many of those markets, the animals are coming from the wild. If you
In those
have real,
markets?
yeah, you can have many of the animals coming from the wild. Yeah, that's the problem. The thing is that they can go and actually poach them in they go and get them sometimes directly from the nests because you want like a nice animal and then basically it's like the hand rearing thing of the animals. These markets can be massive bombs when it comes to transmission of diseases, you know, and like how we talked about all of these things, but this is how viruses are transmitted, how viruses mutate and then often sometimes jump to other species. So this is another big issue, zoonotic issue for humans and whole issue in the world. But unfortunately, yeah, many, if you have those massive markets with so many animals, some can be captive bred, but some are not at all. And the problem is that you can't, the feeling that you would have is actually trying to blame those people and be like, you guys are bad people. But the problem is it's highly linked to the poverty of the people in these countries. So the more, yeah, the more a country is subjective to poverty, the higher the risk of poaching would have like is going to happen because they don't necessarily have the opportunity to get money from different things. So they're going to try to get easy money or the things where they can get the most money out of it. And so they might go and poach stuff that they don't see necessarily as something bad. They're just trying to get money to make their family survive. So it's interlinked with the poverty of the different countries. And yeah, that conservation wise is, you know, for example, the rhino poaching in South Africa. Initially, rhino poaching is not something where people are poor and they just want to get the noses, like the horns from the rhinos. This is something that's also linked with drug drug money, you know, that goes into this. It like
Hmm.
it's linked with countries paying for guns and like this is like a whole mafia going on these things. But you have multiple people that poach animals. Like I was working in Ivory Coast trying to protect the chimpanzees. Chimpanzees would get poached for the exotic pet market. So the
Are
moms would
you
get killed.
joking?
Now we were following
People
them
want
also.
chimpanzees as
Yeah.
pets?
Yeah, yeah.
That's
Chimpanzees, monkeys,
insane.
anything. Yeah. So that's another type of exotic. Some people are saying, oh, rabbits and, you know, parrots and everything, they're not exotic because et cetera, et cetera. It's like, no, this is just kind of a way of saying that they're not a cat or a dog. That's kind of our way of saying it's something else than a
Mhm.
domestic cat or dog animal. But then there's the exotic trade, which is people getting lion cubs and getting chimpanzees and those kind of things. And that exists. And they're trying to sell them and poach them. And yeah. And then the thing is not just this, like chimpanzees, for example, are still being eaten because people kill them and they eat their meat because they don't necessarily have access to other types of foods, etc. So yeah, it seems like shocking to people that you know are used to
That is
eating
not the circle of
chicken
life
store.
that ouch.
Well, unfortunately, this is happening. Yeah, and so this is a problem. We were actually following those chimpanzees, and we now like that project has a huge responsibility now towards those chimpanzees because they got used to having people following them, and now it's kind of like a project that needs to exist forever because they're used to people. If we don't follow them anymore, poachers might start to follow them, and then it's another story here.
Oh my
And
God.
they get shot. I heard gunshots when I was in Ivory Coast during the nights and everything. Yeah, not necessarily just towards the chimpanzees, but there's different small antelopes that were in the forest, and it's called bushmeat. They actually, because they don't have access to cows or domestic animals that they can actually eat, and the agriculture there and the veggies are not, you know, that easily accessible and not necessarily fresh. So they would just go and get the food where they could get it. And on the streets, you could see multiple dead wild animals that they had poached, and they were just like selling it openly on the streets. And it's yeah, like it can sound shocking and you're like, oh, this is horrible, but at the same time like what do you want them to do, you know, like it needs to be, there needs to be a value people need to realize that actually a living animal has more value than a dead animal, and that goes through conservation projects and talking about it. Why is South Africa and the different African countries sometimes very good at protecting different species is because they get a lot of money from tourism. Because the tourists, they pay a lot of money to actually go and see those animals in the wild, and then that money allows them to protect different species. It can create an over tourism issue, and then we get into another problem. I don't know if you've
Yeah.
seen in the wild, people, I've done it. I went to swim with whale sharks in the Maldives, and I was expecting a very nice little area. I'm not exaggerating. I think we must have been 70 people on top of that whale shark. Yeah, I removed myself from it. I was like, this is not ethical. We're harassing animals sometimes, even with the dolphin trips. People are like, oh, like captivity is horrible. They worry better in the wild. Go and see them in the wild. And then you have hundreds of people sometimes on top of dolphins harassing them, and then they can't behave themselves properly anymore, like being touched and express natural reproductive behaviors, etc. So, yeah, honestly, I could go on for hours about this topic, but
Humans, like, what is wrong with us? I'm so grateful that there are so many beautiful souls with good intentions, but there's also so many people who are in bad situations and make bad choices, like you were
yeah,
saying, because they have to, because of
yeah,
poverty, because of lack of food, because they want to feed their family. But there's also people with really bad intentions,
yeah.
like. And so every time the humans with the good intentions try to do something to make things better, there's something bad that ends up happening because we do like too much, or like, we're going to see them in the wild, but then hundreds of people are harassing these animals in the wild. And it's like, where do we find the balance?
Yeah, when you go to those things, I'm like, actually, those kind of projects, for example, in Ivory Coast with the chimpanzees, the fact that a few tourists go and see them with the different projects that exist there is actually some that brings in money, and it sometimes helps to transform poachers themselves into conservation advocates, because some of the people that are helping out with the chimpanzees were previous poachers, and like
Wow.
if you work with communities like this and you make them understand that, if you kill one, you might get that much money out of it, but it's just one, and basically that's it. But if you keep them alive, you might have a continuous source of revenue coming in. That can transform completely lives, and it's a whole, yeah, it's a whole big way of working with different communities. It's not as easy as just being like, they're horrible, you should not do this, because in the modern society, we don't eat chimpanzees, but we eat the cows and everything, and it goes into those intensive farming situations. So it's not necessarily better, you
Yeah,
kind of have to find a balance in those kind of things.
I saw this video that was like, this is the circle of life, this is not. And it was like
Yeah,
showing videos of like a lion attacking an antelope. And
yeah,
then it showed a video of like thousands of chickens crammed in this like warehouse space. And then
yeah,
it showed, like a bird catching its prey, like a hawk catching a bird. And then it shows like all these cows that are like in these cages just waiting in line,
yeah,
to basically, the end of their life. So
yeah,
yeah, like there's a whole issue, and I think like, showing people and giving them this information, it can also transform not only the poachers, but like regular people. Like, look at me. I'm completely transformed from, the first time that I had mango from day one to now with Mia. Like, I'm completely different, and I'm advocating, on social media and online as much as I can. And it's changed me, like all of this information and knowing this. So I think people having those experiences and having this information, it can change like regular people who maybe aren't vets or have had this adventure movie of experiences like you, or, you know, just regular people. And we can learn how to advocate for these animals. And, what I also appreciate about the work that you do is you are a voice for the voiceless, because as humans, we speak, we can express, we can say what we need, what we don't like, and so on and so forth. But for the animals, we can't. So, or they can't speak. So we need to understand them a little bit better. I
yeah,
wanted to share a few facts that I found about the illegal wildlife trade. Let's call it the Parrot cartel, because what I didn't know, and we should all know because it should make you feel shocked. Like my jaw dropped and I just felt infuriated. The wildlife trade is valued between 7 and 23 billion dollars per year globally, making it the second largest black market after drugs.
Yeah.
Like that is crazy to me. And approximately 800,000 parrot chicks are poached from the wild every year to supply the pet trade. Like that is like we need to know these statistics and these facts so that we can realize like what is actually going on out there. And then also, I know there's a lot of amazing organizations that are working, to help these animals, like the World Parrot Trust and so many more. Um, but I think that as regular people, we need to be aware of this so we can support these organizations and also do what we can to not support these poachers. And maybe we need to think of ways of creating jobs or for these people so that they have a different way to make money instead of poaching animals from the wild. Then
Yeah.
another statistic is up to 90% of wild caught parrots die in transit. For every one that reaches a pet store, several have already died, which is completely heartbreaking. I remember seeing it went viral, like these cockatoos that were stuffed in plastic water bottles, and many of them died. I even read that they stuff them in the plastic bottles and then go through sea so that they don't get detected. Oh, it's just a plastic bottle in the water to get to the other side. And they do a
Yeah.
lot of this by land and by sea because in the air it's a lot more regulated. So, yeah, the statistics, the numbers are just heartbreaking. So, yeah, we need to bring more awareness to this. But last year, there was a huge win because in the Democratic Republic of Congo, it was nationally banned the capture, trade, and possession of African gray parrots. So, I mean, that's a good step in the right direction what these organizations are doing. But like, what have you seen when you've been like out there doing this conservation work or like seeing parrots in the wild, if you have?
So I haven't seen the parrots in the wild. It's one of the things I can still add on my things that I have done but
Okay,
haven't
more
done yet.
adventures in the
Yes.
future.
But I've dealt with poachers themselves for the sea turtles, for example. The center I was working in, there was a kind of like two different ways of working with the sea turtles. The adult ones that we had in the center often were a consequence of actually being caught in what is called ghost nets. I don't know if you've heard of this. It's nets that are coming from the fishing industry, but that
Oh,
have been
yes.
discarded or lost at sea.
Hmm.
And that's a big issue because that's actually the number one plastic that we can have in the oceans. It's not necessarily the straws and everything. We see the straws, which is still a big issue, but it's actually the fishing nets that are one of the biggest issues of plastic inside of the environment. And then it's a ghost net because it's just like it floats around, and then the turtles, and not just turtles, the sea lions, the fish, the shark, the dolphins, everything gets stuck in there, and then they die in those kind of nets. And the thing is that the turtles that we had that were adults, most of them were amputated from one or more flippers, and amputated, like they lost the flipper. It's not necessarily due to a surgical procedure. It's actually that sometimes they stayed stuck in those nets for months before they were found, and then the nets that ended up killing their flippers. Yeah, I'm using very shocking words and everything, but it's actually communication about those subjects like this, and not kind of trying to sugarcoat that it is potentially going to help the problem.
Hmm.
So that's actually due to the fishing industry, of us like trying to get a lot of fish, etc., out there, and then not necessarily discarding those nets properly, etc., that lead to those kind of problems. But then we got to the poaching problem, is that many of baby sea turtles, we went to collect baby sea turtles in homes of people that were living in the Maldives. So the people from the Maldives, not necessarily the tourists coming on the different islands, but the people really living on the Maldives, they love to have pets. So they sometimes went ahead, and when the babies, they would hatch and they would want to go to the sea. Some of them were just caught. And then they place them it's still a massive problem, is they place them in their bathtub in fresh water, which is not even salt water, and after a few days/weeks, they're dead. So we were trying to communicate a lot about this with people and then we ended up, thanks to communication, having few people here and there, it's still a beginning, not everyone, but actually coming to surrender their sea turtles to us. And then we could start a rehabilitation process. Some would die during the rehabilitation process, and then you had to habituate them going from fresh water to salt water, which is a progressive thing. If you just then ditch them back in the ocean, they get like a salinity shock, if you can kind of compare this. So it's a whole process that they have to go through, and then they have to be released as quickly as possible, because those first few days/weeks is really the moment where these little guys, they have to swim for their lives and survive the first threats that they have in the ocean, and try to find like a safe area where they can kind of like grow and find a bit of food. So it's really critical. And one sea turtle out of 1,000 is estimated to make it until adulthood. So one out of 1,000. That's just a natural way. Yeah. Unfortunately, these sea turtles, they don't have an easy life. But since the moment they are born, they're fighting predators, they're fighting currents, they're fighting a lot of different things. Can come from the crabs, from the the seagulls, the dogs on the beaches, then the different sharks and fish in the ocean. They're really constantly fighting threats. So only one out of 1,000 usually makes it out of like until adulthood. And then of course you need absolutely those adults to lay eggs, because one female is estimated to lay about like 2,000 eggs in her lifetime, which means that if you lose that one female that could have made it until adulthood, you actually lose those 2,000 eggs, which could have made two adult sea turtles afterwards. So big issue.
Those
This
are
is not
not great
necessarily.
statistics.
No, they're not good. So basically, that means that if you poach those little sea turtles, you lower those statistics. And some
Mm.
people, their argument would actually be, we save them because we know that they die from predators in the wild. So we actually saving them by keeping them. So again, not necessarily coming from a bad idea in the beginning. It comes from potentially an empathetic, way of wanting to see animals. It comes also sometimes from a complete selfishness. If I just want to have a sea turtle at home and I don't care if it dies, I get another one. That's also an attitude that exists. But yeah, so we were trying to communicate a lot and talk about those subjects and make them realize that this is not the way to go, because you're going to destroy the whole wild population, and it's already struggling with the fishing nets and with the pollution in the ocean, etc. So yeah, not necessarily parrot oriented, but poaching problems are a big issue in the world, and the exotic pet trade adds a big problem on
Yeah.
top of it. Yeah.
Yeah, absolutely. I also wanted to mention that I was reading up that the three biggest hotspots where they poach parrots from the wild is African greys from the Democratic Republic of Congo, and then Mexico and the neotropics for Amazons and macaws, and then Indonesia for cockatoos and lories.
Yeah.
So when it comes to those species, just like make sure. I guess the whole point is just to be sure like that we are aware of this issue and, just kind of do some digging. Like if you want to get a bird or you're getting a bird, who are you getting it from? And are you supporting this wildlife in or poaching illegal pet trade or not?
Yeah.
So yeah, I really love all of the work that you've been doing and all the messages that you've been sharing online. So thank you so much. And share with our listeners where they can find you, how they can follow you and follow your work.
So my account is Dr. Noémie Exotics Vet. I am way more active on Instagram than on the other ones. I'm also on Facebook and TikTok, but I'm not really. I'm a bit like, I post and I ghost because I have way too many things I have to do already on Instagram, and a lot of people to answer in the messages, etc. So this is my account. I also made a YouTube account not too long ago. I'll try to kind of post longer videos and maybe more long educational videos, because social media is nice to spread the word, but it depends on the algorithm. It depends on if you hook the people well, and if it's a topic that might interest them. And you you actually might not be able to spread the message as well as you could potentially do it in longer videos. I'm thinking about subjects. I'm trying to see what I can develop, but I also still have my job on the side, so
Yeah,
it
it's a
takes me
lot.
time. It's a lot. And I see a lot of people in the comments, they're very excited about the things I'm posting. And they're like, oh, please do this species, this, cover this. I'm like, I'm keeping track of the things, but it
But I'm
takes a lot
only
of
one
work.
person.
I'm one person. I don't have a team yet. I'm not working with anyone. So please give me a bit of time. I'm getting there. I'm going to spread more about more species, about more pathological issues, about how you make sure, yeah, conservation links, how you make sure that they don't get sick and you give proper care. But yeah, talk to Noémie Exotics Vet. That's where I'm right now.
Amazing. All right. So we'll wrap things up for today. We're going to do some fun questions before we say goodbye. And I'm just going to ask you a question and you can give us like a quick response to the
I'm not
question.
good at quick responses.
No worries. So we'll give you some time to think.
Okay.
Your favorite parrot species and why?
Conures. I find them cheeky. Yeah, it's just maybe because they are so cheeky and they can be so annoying to
I
different
love
people.
their
I was like,
faces.
yes,
They have such
yes,
cute little faces. I'm like, you're such a bugger, but you're so
yeah.
cute.
And then in the hospital, they look at us. They're like, we're going to rip your finger off, and you're like, oh, you're so cute. I just
Yeah.
love you.
When Mia gets like angry and she like puffs up and she wants to be all big and bad, I'm like, you look so much cuter. I just want to
Yeah,
squeeze you. And she's like, I want to bite you.
yeah, they're
I'm like, you
cheeky.
have no idea how adorable you look. The funniest thing that a parrot patient has ever done during an exam or eval.
Uh, it's not necessarily super funny, I would say, but it's just basically people being annoyed because at home they might be so vocal and aggressive and whatsoever. And sometimes they bring them to the vet clinic and then they're like, watch out, like he's mean at home. And then they're actually super sweet and super gentle. And then you see the faces of those people be like, that's not how he is at home. It's not always how it is because we can have the opposite. They can be very sweet at home and diabolical in the clinic. But when you see this and the people are like, I disagree. Like this is not how he is at home.
See, Mia's actually the opposite. She's so good at home and good with like, people if they come over and stuff. But at the vet, like sometimes she can be like a little bit like frisky and a little bit bad. And it just depends on like her mood that day, I guess. And on our last visit, I asked the vet, I'm like, on a scale of 1 to 10, compared to all of your other parrot patients, how did she do? And she's like, 4 out of 10. Like she was great. And I'm like,
Yeah.
oh. Mia, you're not that bad. And I'm like, you are
Yeah.
only 40% bad and 60% good. That's
That's
awesome.
good.
Okay, if you could be any animal for a day, what would you pick?
Ooh, that's not a quick question. That's like this is like a whole depth investigation on myself. Uh, uh, um, a turtle, I would say, because I like the
Really?
marine environment. Yeah, if I don't get caught in a ghost net and I don't get poached,
Yeah.
then yes, sure. I love the environment, the marine environment. I love diving. I love being in the middle of different species. I love my species that I really love and to look at are actually sharks, but I wouldn't necessarily want to be a shark because you don't have to kill a lot of different species too, so let's just
Yeah.
survive. I don't want to participate. But yeah, a turtle, why not? A green turtle, so I can just graze on sungrass, on seagrass, sorry, and just chill and see the reef.
That's amazing. I love it. What's one thing most people don't know about working as a vet with exotic animals?
Well, it's kind of what we already talked about. It's basically most of the diseases that we see are 100% preventable. So it's not like crazy diseases. We sometimes get some, but that's not the majority of what we see. What you maybe not know is that we spend a lot of time in books because there's so many different species and there's so many different topics and there's so much that is evolving continuously when it comes to the knowledge that we have.
Mm,
We spend our times in books. Also for the dosages of medicine, we have like a whole book that is just base dosages of how much medicine we have to give because the medicine for a conure is not going to be the same dose necessarily as a macaw, etc. And we can't memorize all of these ones. So you might see the vet at some point stepping out and being like, I'm going to get something, which is usually what we do. We take medicine, but we also go to the book and we calculate and we have to dilute a lot of the medicine because the medicine is made for cats or dogs or bigger species. And then when you get to an animal that is only a few grams, you actually have to dilute everything. So it might take a long time to calculate that 0.1 milliliter that we need. And then you have to dilute it 100 times to get to the medicine that you can actually give to that one. So it's a lot of adaptation with medicine that is not adapted for these guys. So we have to calculate those things, a lot of math.
Wow, that's crazy. I didn't know math is involved. Well, good
Yes.
thing I didn't become a vet.
Yeah.
If your animal or exotic patients could talk, what do you think they'd say about their vet visits with you?
I think they would say that they hate me.
Aw.
I keep telling people it's like usually we become vets because we love animals, and then most of the animals, well, they are stressed because they come to the vet. So and then we do not nice things to them. I don't like going to the doctor, but I know why I'm going to the doctor. So they don't know why they're going. So they just get handled, they just get, injected with things and everything. If we could explain it to them that it's really for their own good, but we can't. So I think that if they could speak, they would definitely say like, I hate you, you're doing things that I don't like to myself. So yeah,
Aw.
unfortunately, I like animals. The animals usually don't really like me in the vet setting. So yeah.
That's why you're advocating for preventative care. So
Yes, because I
that
don't want to see them if they don't have to come to the clinic.
exactly. All right, last one. The coolest experience you've ever had in your conservation work. What was your best memory?
Oh, well, you've seen how many I started sharing already. I have a
I
lot of different
know. I've seen you
experiences.
like in a helicopter.
Necessarily follow them in cars and everything. So you have to often anesthetize them from a helicopter. But I had to anesthetize some mangabeys, the small little monkeys, actually in Ivory Coast. I had almost nothing. I had a pole that is used, and you have to kind of blow in it to throw the little dot inside of the
Yeah.
animal. And it was a group of animals that were followed in for tourism. So the point was not to make them scared of humans. They needed to keep the trust in the humans, but they
Mm.
were sick, and I needed to intervene on them. I needed to take some blood and give some antibiotics, etc. So the thing is, I had to walk around with the people that usually follow these guys because I wasn't following these ones. And then I had to wait for them to be placed in a specific way for me to get as close as possible as I could to the animal, but without the animal looking at me. And then I had to blow that syringe quite quickly. And then I had to hide the pole and kind of look around as if like what just happened, because they needed to understand that I was not the one doing those kind of things to them. And then the thing is, they would then climb into trees that were very high, and we had to wait down, with a towel to actually grab them when they would be anesthetized. And that was very stressful because I was like, we're going to do all of this to help them, and what if we can't catch them?
Oh
That's
my
that
gosh.
is
But I
really
saw you
stressful.
had a very good success rate, 3 out of
I
3.
had 100% success rate, which is I was very lucky too. But yeah, so that was a cool experience, I would say. But it's one of so many.
Yeah, so many.
Yeah,
Well, thank you so much, Dr. Noémie, for joining us today, sitting down with
thank
us,
you.
and sharing all this information with us. I know I've taken a lot away from our conversation today, and
Oh,
I'm sure the person listening has too. So thank you so much. What are your parting words?
yeah, thank you for having me. Basically, my parting words would be, if you want an animal, specifically a bird, make sure that you read up on them, specifically on the species that you're going to house. And if after documenting yourself and reading up that much, you realize that this is not for you, like don't take them. And that is perfectly fine. If you get to that realization, like that's what I want people to take out of it. It's basically you need to know what they need, and if you can't give them what they need, just don't take them in.
Here she is.
Ah!
She always does
Hiding.
this on every podcast. She just, as soon as the microphone comes out, she like knows that I'm just gonna sit here and chill and talk, and she just
Yeah,
goes into
she's
my
already
hair.
half asleep right now.
Yeah. Her eyes are completely like closed.
Yeah. So maybe your voice is soothing her.
Oh, and one more thing. This podcast is presented solely for educational and entertainment purposes. I'm not a licensed avian vet, behaviorist, or professional expert in parrots. The information provided is not intended as a substitute for professional advice from a qualified avian vet, trainer, or behaviorist. Please consult with a specialist for personalized guidance on your specific situation.